Dr. Narod is a world-renowned scientist. He has been recognized by multiple communities and received many, many awards for all of his work. In particular, and I think most meaningfully, I've heard from other scientists who are part of that community that he has challenged them to think a little bit more broadly and deeply on how they've addressed treatment of women with breast cancer.
Dr. Narod thinks about the patient and sees what more information or what knowledge can be useful for the patient when they're making decisions in their care. And so he's pretty much revolutionized how we treat patients with a gene mutation that increases their risk of future breast or ovarian cancer.
So my first start was really in the genetics of breast cancer. At that time, it was kind of a race was on to look for breast cancer genes. Now, 30 years later, I continue to work in the area and have been following the research ever since. I was offered the first Canada Research Chair in breast cancer here at Women's College Hospital, and that was really an opportunity. I was really looking forward to it.
He's pretty much come up with the field of cancer genetics. In fact, he was part of the initial team that discovered the BRCA genes.
The two genes, BRCA1 and BRCA2, really stand for breast cancer 1 and breast cancer 2, which is the order in which they're discovered in 1994 and in 1995. What it means is we all carry 2 copies of these genes. Everybody's born with 2 normal copies. For some people, about fewer than 1%, it's the inherited copy that's broken, a mutant copy. And if you have one of those mutant copies, you're born, you're perfectly well, but as you age, you show a tendency to develop breast cancer, many times higher than that for people in the general population or people without the mutations.
He is really being transformative and being relentless in his ability to hone in on key questions of how you manage patients, whether they should get aggressive forms of management or treatment, what are preventative therapies that could be done, what are the risks for other types of cancers in those patients who are gene carriers. I think that he challenges the community, both the academic community as well as the clinical care community for breast cancer, to think differently. The SCREAM project was developed as a research project in order to enable women to get breast cancer screening before they develop breast cancer, in case there was a family history of it within their families, and that it wasn't paid for at that time.
And sometimes the waiting lists were in months or even years. But I also thought that if a woman wished to have testing, but was denied testing through the traditional routes, that they should be able to opt for the testing at their own volition.
His office door is always open and he's always in his office. And so as a mentee, if I ever had any questions or any ideas or any uncertainties, I can always just walk by and get his input.
I like to think that I'll be able to pass it on through the legacy here at Women's College Hospital, training through graduate students, training summer students, medical students. It's been a great achievement for me and admiration to be able to say we've been able to train others.
Dr. Narod really cares about the work that he does, and you can tell by the way he treats his staff. He's very appreciative. He tells everybody thank you because he knows it's not a small undertaking. So just the passion that he displays and the fact that he cares so much is something I think everybody should know, that behind the big name, Dr. Stephen Narod is a man who truly cares about saving the lives of women that are affected by this gene mutation.
Driving force in hereditary breast and ovarian cancer research, transforming genetic risk assessment and cancer prevention worldwide. Canadian Medical Hall of Fame laureate, Dr. Stephen Narod.